So good morning to all. So today's topic is regarding the NSIDs. Once again is the new topic today. So what is NSIDs? NSIDs means non-steroid anti-inflammatory drugs. Means that is not steroid but inhibit the inflammation and also pain. That is the non-steroid anti-inflammatory drugs. Yeah? The NSAIDs means the non-steroid anti-inflammatory drug. Non-steroid anti-inflammatory drugs. So, what is the mechanism of action of NSAIDs? The mechanism of action of NSAIDs to inhibit the COX enzyme. To inhibit the COX enzyme, so that they inhibit or decrease the inflammatory or pain. Inflammatory action and pain. So, what is the MOA? MOA means mechanism of action to inhibit or decrease COX enzyme. Yeah. So, in the exam, there will be asked in the exam. So, what is the mechanism of action of NSAIDs? The mechanism of action of NSAIDs to inhibit or decrease the COX enzyme, so that it will be reduce pain and inflammation. So, then we move to the paracetamol. Paracetamol. The paracetamol. Paracetamol, otherwise called as the acetaminophen. Acetaminophen. Paracetamol is otherwise called the acetaminophen. It is highly reactive in antipyretic and analgesic. Paracetamol is highly reactive in antipyretic and analgesic. Highly reactive in antipyretic and analgesic. Clear? The paracetamol is the acetaminophen. Paracetamol is also called as the acetaminophen. Acetaminophen. So the paracetamol or acetaminophen is highly reactive. Means highly actionable in the antipyretic, means the pyrexia, to reduce the temperature, and the analgesic action to reduce the pain. But it is poorly reactive in anti-inflammatory action. Poorly reactive in anti-inflammatory action. The paracetamol is poorly reactive in anti-inflammatory action. Anti-inflammatory action. Then what is the dose? What is the dose of paracetamol? The dose is greater than 150 to 250 mg per kg body weight. The paracetamol proper dose is greater than 150 to 250 mg per kg body weight. This is the important. So we should give the maximum dose in less than 4 gram per day. We should use paracetamol in a day maximally less than 4 gram. Clear? Maximum dose less than 4 gram per day. The maximum dose of paracetamol in a day is less than 4 gram. The maximum dose is less than 4 gram per day. We should never use or exceeds the greater than 4 gram per day. We should never exceed the dose of paracetamol greater than 4 gram per day. Why? Because it is hepatotoxic. It creates toxicity and causes the liver dysfunction. So that in a day we should never exceed the paracetamol dose less than 4 gram. Because it is hepatotoxic. Hepatotoxic. Because it is hepatotoxic. Then is the antidote. What is the antidote of paracetamol? The antidote. The antidote. What is the meaning of antidote? If we administer overdose, then it create toxicity in our body. So to control or inhibit the toxicity, we can administer the antidote. So antidote of paracetamol is the N-acetyl cysteine. N-acetyl cysteine. So the brand name is the Mucomix. So brand name is the Mucomix. This is the brand name. So the antidote of paracetamol is N-acetylcysteine. N-acetylcysteine. Then it is the Mucomix. That is the antidote. The question asked in the exam, what is the antidote of paracetamol? That is the N-acetylcysteine. So remember this. Then we move to the aspirin, that is the acetyl salicylic acid. That is also a Nsaids. It is the aspirin called acetyl salicylic acid. The aspirin, aspirin also called the acetyl salicylic acid. So how it works? Means the acetyl salicylic acid or aspirin, how it works? It works as a anti-aggregant, anti-aggregant, anti-inflammatory, anti-aggregant, anti-inflammatory, then anti-analgesic, then antipyretic. And antipyretic. There are four actions in the aspirin. There are four actions in the aspirin. It is the anti-aggregant, anti-inflammatory, then the analgesic, then the antipyretic. Antipyretic. That is the four actions of acetyl salicylic acid or aspirin. Then what is the side effect of acetyl salicylic acid or aspirin? SE means the side effect. That is the salicylizine. Salicylizine means the drowsiness or tinnitus. The patient feels drowsy, and the tinnitus means the ringing of ears. Ringing of ears. That is the salicylizine. Then aspirin is strictly contraindicated in the children. In the children. That is the side effect. Contraindication. Contraindication in children. The aspirin is contraindicated in children. The aspirin is contraindicated in children. Then aspirin also used in the Ray's syndrome. So the Ray's syndrome is due to the long-term aspirin use. The Ray's syndrome. Ray's syndrome is due to long-term aspirin use. The Ray's syndrome in children is due to the long-term aspirin use. The question asked in the exam, the Ray's syndrome is due to the which drug? The Ray's syndrome is due to the aspirin or acetyl salicylic acid. That is the question. Then another one, the Nsaids, the indomethacin. Indomethacin is the another one type of the Nsaids. that is used to treat acute gout. Indomethacin. That's the indomethacin. The indomethacin is the type of the NSAIDs. The type of NSAIDs. The use in acute gout. The indomethacin used in the acute gout. Okay? Acute gout. So, if the question asks what is the drug of choice of acute gout, that is the indomethacin. That is the indomethacin. So, what is gout? Gout means increase uric acid in blood. Increase uric acid in blood causes gout. So gout mainly affects the grade 2. Affects the grade 2. The gout mainly affects the grade 2. Affects the grade 2. This is also a question. Means the indomethacin is used in the acute gout. In the acute gout, this is a question, and the gout affects in the grade 2. Primarily affects the grade 2. It is the second question. Then we move the another NSAIDs. Then we move the another NSAIDs that is used in day-to-day life. That is the king of NSAIDs, also called as the king of NSAIDs. That is the ibuprofen. The ibuprofen. In the day-to-day life, we also use the ibuprofen. Ibuprofen. The ibuprofen is a NSAID. It is the main drug of choice to closure the PDA, means the patent ductus arteriosus in children. To treat or closure of PDA. The ibuprofen mainly to treat or closure. The ibuprofen mainly to treat or closure of PDA. What is PDA? Is the patent ductus arteriosus. Is the patent ductus arteriosus. Patent ductus arteriosus, that is happen in the children. That is the congenital. Means the from birth it should be happen in some children. That is the PDA. PDA also a congenital. Congenital. In pregnancy, if the mother takes some teratogenic drug, it causes the congenital. In some cases, there will be no reason in PDA. Then we also use the ibuprofen in the headache also and inflammation also. Then we also move the another NSAIDs, that is the selective COX-2 inhibitor. Selective COX-2 inhibitor. Selective COX-2 inhibitor. That is the another type of NSAID. That is the selective COX-2 inhibitor. Selective COX-2 inhibitor is the another type of NSAIDs. Yeah. That is the drug is the celecoxib. The celecoxib is a selective COX-2 inhibitor. The celecoxib is the selective COX-2 inhibitor. That is a NSAIDs. What is the benefits of this NSAID? The benefits is it causes the less gastric ulcer among all NSAIDs. The all NSAIDs causing highly gastric ulcer or should be chance to high gastric ulcer. The celecoxib or the selective COX inhibitor have lesser chance of gastric ulcer. Gastric ulcer. Among all NSAIDs, the only NSAID, the selective COX inhibitor, have lesser chance of gastric ulcer. Lesser chance of gastric ulcer. All another NSAIDs have higher chance of gastric ulcer. So celecoxib is the safest drug among all NSAIDs. So, celecoxib or the selective COX inhibitor is the cardiotoxicity. It is also cardiotoxicity. The selective COX inhibitor is the cardiotoxic. It is the cardiotoxic. So we do not use the celecoxib in case of the hypertension. So it will worsen the hypertension. Not used in HTL patient. The celecoxib is not used in STN patient. It causes the worsen of the hypertension. So in the hypertension patient, we do not administer the celecoxib. That is the group of selective COX inhibitor. In rheumatoid arthritis, it is the best drug of choice. The celecoxib is the best drug of choice in rheumatoid arthritis. Rheumatoid arthritis. The celecoxib is best drug of choice in rheumatoid arthritis. So this is all about the NSIDs. Next class we will discuss about a new topic. So read carefully, remember carefully. So thank you to